Hi, Dr. J. George, bariatric surgeon. So, one of the most commonly asked questions that I get from people that are interested in weight loss program or weight loss surgery is whether they have to pay for this or whether their insurance will pay for this. And um, insurance plans have improved a lot over the last 10 to 15 years to the point where a majority of insurance plans do have bariatric benefits. Now, of course, that's not all of them. And what's important to realize is that either you can call your insurance company or talk to your human resources department at your employer, or we're happy to call for you to double check because we obviously don't want to assume that you have benefits and get you plugged into a program and then find out later that you don't actually have benefits. So simply calling your insurance company or having us call or asking your HR person is the best way to see if your plan covers bariatrics. And if you do have bariatric benefits, then in general, as long as you meet the criteria to have bariatric surgery, then your preoperative process of going through nutrition and psych and that sort of thing, as well as the surgery and the initial postoperative care, is covered by insurance. Now, every insurance plan obviously has some different criteria for what they expect someone to do in order to qualify for surgery. Typically, there's a certain number of diet classes that you're expected to do. Some insurance plans only want 2 diet classes, some want 6, some want 12. So that's something to keep in mind, and we can let you know depending on what kind of insurance you have. They require a psychology clearance. They require blood work. They require something called a letter of recommendation or a letter of medical necessity from your primary doctor or your family doctor, which is a letter basically saying that your family doctor thinks that a bariatric procedure would be helpful for you in improving your health, because they obviously want to hear, the insurance company wants to hear from someone else besides us that bariatric surgery would be good for you. So we can talk about, once we establish that you have bariatric benefits, we can sit down in the office and kind of go over sort of what the expectations are from your insurance company to kind of get things done and wrapped up to apply and get the surgery approved. The other thing to keep in mind for those of you that have found out that you don't have bariatric benefits through your insurance plan is that you can call your insurance company up and say, hey, listen, I'm interested in bariatric surgery. Is it possible to switch over to a plan that has coverage or has benefits? So if it's through your employer, you can talk to your employer or your HR. But that's definitely an option. The other option is to look at other insurance alternatives. If you can't get another plan with the same insurer, would be to look elsewhere with other insurance companies. The other option that you do have, if you can't get insurance that has bariatric plans and you've kind of tried some of those things that I just mentioned, is we do have financing options for the bariatric surgeries. And so, yes, that would end up being money out of your pocket, but it can be spread out through a financing plan, and it doesn't have to, be a lump sum up all at once. So that's something that we can sit down and discuss as well.